So you think you have OCD. Maybe you've even gotten professionally diagnosed based on the very helpful advice that I gave in my previous video. But now the very important question remains. What do? If you're anything like me, you might find that your first reaction to learning you have OCD is something like, cool. Now, how do I get rid of it? And when you realize that you can't just get rid of it because, like a lot of mental illnesses, OCD is a chronic condition, your reaction might look a little bit like this. Now, if you're currently in this phase, I encourage you to try not to despair. Remember that just because you can't get rid of something forever doesn't mean that you're doomed. You can learn to coexist with its presence in your life, like an annoying roommate that's more or less easy to ignore. That's basically what treating a disorder means. In this video, I'll be going over some of the most common treatment methods for OCD, including cognitive behavioral therapy, or CBT, and also medication. This will show you a few options that you may want to explore. More importantly, it will show you that you do have options, even if it might not feel like it right now. Now, I don't think I'll be surprising anyone when I say that OCD is closely related to anxiety. But there's a difference between causing anxiety and being an anxiety disorder. And this is kind of a gray area because up until 2013, OCD was categorized as an anxiety disorder in the DSM. And then it was removed from this category and put into its own class of OCD and related disorders. And there was a lot of controversy over that. The main reason is that the same treatments that work best against OCD are also the same treatments that work well against other anxiety disorders. And those treatments are forms of CBT. So cognitive behavioral therapy is, as its name suggests, a form of therapy based on cognitions, which are ways of thinking, and behaviors. CBT was pioneered by Aaron Beck, who posited that people who suffer from mental illnesses actually have irrational and unhelpful ways of thinking about the world and themselves, and he referred to these as cognitive distortions. His main idea was basically that by changing these cognitive distortions into more rational and positive ways of thinking, you can also lead to a change in behaviors. So that's really the main idea behind CBT. In my personal experience, doing CBT for OCD, that's a lot of acronyms, has felt like trying to build a big crystal protective dome around my brain, so that when I have a thought, instead of immediately accepting it, I can observe the thought instead as it comes bouncing off the dome. Does this thought make sense? Is there evidence to support it? Or is it just more OCD bullshit again? And no, you can't always control which thought comes bouncing off the dome, but you can control your reaction to it. You can decide if you want to take off the dome and accept the thought as true, or if you want to leave the dome on and let the thought move on. This also implies that there are no inherently good or bad thoughts. Everything depends on your interpretation of these thoughts, and then how you decide to act based on these interpretations. Those are things that are very hard to learn for most people with OCD. First, because thought-action fusion makes us identify with our thoughts very closely. We're used to automatically absorbing every thought we have into our spongy, vulnerable gray matter. Like, if I have a thought about pushing someone into traffic, that's not only a random thought, it's something that carries deep meaning about me. It means that I'm not only the kind of person who would have this thought, but I'm also the kind of person who would do this thing. Like, this thought is me, and I am the thought.
This is me now!
Additionally, our excessive sense of moral responsibility also tends to make us very judgmental of our own thoughts. So our brains will automatically decide that this specific thought is a bad thought, and since it came from us, it means that we're a bad person. Now, compulsions are the behavioral part, and in CBT terms, compulsions are responses to interpretations of intrusive thoughts, and to that feeling of needing to do something immediately. Intrusive thought. Oh no, I just had a thought about pushing a random person onto traffic. What does that mean? Interpretation. This means that I'm a no-good, very bad murderer person. Anxiety. I need to do something to undo this right now. I need to make this right. I need to fix this. Compulsion. I know. I'll stomp my foot on the ground 4 times and everything will be alright again. So we become irrationally convinced on some level that these compulsions can neutralize our intrusive thoughts and prevent them from becoming real. And because of that, compulsions actually work, temporarily at least, at what they're supposed to do, which is make us feel better. After doing a compulsion, people with OCD feel safer, less anxious, and that's why we keep doing them over and over again. But that's also exactly why they're maladaptive. In exchange of giving us this temporary reassurance, compulsions actually deprive us of a very important learning opportunity, the chance to do nothing, wait, and see that nothing bad actually happens anyway. This learning opportunity is called exposure, and it's exactly what it sounds like, forcing yourself to face the thing that causes you fear or anxiety. In OCD's case, that would be a distressing, intrusive thought, without resorting to safety behaviors, like compulsions. So you see how CBT takes OCD's irrational, superstitious ways of protecting us and tries to retrain us to learn that we never really needed to be afraid in the first place. The goal of all CBT is to help patients develop more rational, realistic cognitions so that we can develop more rational, positive behaviors. This is why a therapist can be very helpful to us. But it has to be a collaborative process. I think many people are afraid of therapy because they have this image of the evil, all-knowing psychiatrist who puts his fingers inside people's brain and moves them around like puppets. And in that sense, pop culture depictions of mental health specialists maybe haven't helped. But the truth is that therapists and patients operate as a team, and the strength of that relationship has a huge impact on the effectiveness of therapy. So if you find a therapist that you don't want to let inside your head, chances are they're not going to be able to get in there, at least not in a way that helps either one of you. Another thing to keep in mind is that CBT is more an umbrella term than something that refers to a specific technique. It's known for being very flexible and adaptable to individual cases, and that's because it draws from multiple different strategies. So some strategies offered as part of CBT might include thought recording, so keeping track of your thoughts, usually with a journal of some kind. There's also visualization, which is a relaxation technique based on mental imagery. So you and your therapist will work together to develop this very personalized description of positive mental images, like your own happy place. And mindfulness meditation, which is based on staying grounded in the present moment instead of worrying about what may or may not happen in the future. And since CBT is often used in conjunction with medication, we have to talk about the drugs. That's another common scary stereotype about therapy, that it's all about stuffing your gullet with pills until you're nothing more than a living zombie. The truth is that's not the case. Medication is very rarely the first course of treatment recommended for most mental illnesses, and it's definitely not the go-to for OCD. With OCD, people will usually recommend some form of CBT and exposure-based therapy, and then they'll only suggest medication if therapy doesn't seem like enough, or if you're so anxious and distressed that you're not able to fully engage in therapy. Trust me, it's not that easy to get the drugs. But if you are invited to consider medication, usually it'll be some kind of antidepressant. So selective serotonin reuptake inhibitors, or SSRIs for short, are the most commonly prescribed antidepressants. They're very effective against OCD, and they're also very popular because they usually have few side effects. But usually the strongest treatment plan is a combination of therapy and medication, with the meds acting as a complement to the therapy and not the other way around. And it's the kind of treatment plan that's currently being used by yours truly, because my OCD is one tough bitch. So there you have it. This was a short but hopefully informative little overview of the kinds of treatment methods that can be used against OCD. This is by no means an exhaustive list, but all of this is to state that you have options. There is a way out of this mess. There are several, in fact. So if one doesn't work for you right now, you can always try another one. And all of these can contribute to making OCD into an ever smaller part of your daily life. If you have any questions about anything I covered, feel free to leave them in the comments and I will go take a look. And if you enjoyed this video, you can like and subscribe if you want more content like this.